Malo elele and warm Pacific greetings. My name is Joanna Bourke and I serve on the board of the National Foundation for the Deaf and Hard of Hearing. And it is a privilege for me to be in this space today for our Pasifika Talanoa. I'm here today in a governance role, simply to help open the space so that your voices and stories and your lived experiences can shape this national hearing health strategy. For me, this work is deeply connected to the quality of life, the ability to spend meaningful time with the people we love. Hearing loss affects many of our Pacific families. It can affect how they participate in conversations, how confident they feel in their social settings, and how connected they feel to the family and their community. Sometimes our people will sit back more, speak less, or avoid gatherings, not because they don't want to be there, but because it becomes harder to follow what's happening. That kind of quiet isolation is something many of our families recognise. In my own family, I've seen different experiences with hearing loss. My father lived with hearing difficulties for many years, and like many of our Pacific elders, he didn't want hearing aids or to draw attention to it. That's a very familiar story in our communities. We often carry these things quietly. And I've also seen the power of early support and attention. My brother is a professional artist, a musician and singer. Because he received early intervention, he was able to pursue his love of music, study, and perform globally, and continues to do so today. That early help protected his confidence, his joy, and his ability to express himself. These experiences remind me that hearing health is not just a medical issue. It's cultural, it's relational, it's about the va. It's about ensuring that our Pacific families can stay connected, participate fully, and enjoy life without shame or isolation. And that's why the strategy matters, and that's why your voice matters. Pacific peoples experience higher rates of preventable hearing loss. Pasifika tamariki are being referred to audiology 1 to 2 years later than other children. Our Pasifika families are 7 times less likely to attend that first hearing appointment. And too often, the system doesn't take a family centered approach that reflects how we actually live with ainga, with whānau, with family, with our community, with shared responsibility. For many of our family, hearing loss can look like social isolation, withdrawing from community events, our elders feeling less confident to share their stories, or grieving the loss of access to our languages. Our tamariki can be misunderstood, seen as naughty or struggling at school, when really they just can't hear properly. These inequities are real. They affect quality of life, confidence, connection, and the ability to fully participate in family, church, school, and community life. And that is why Pacifica Voices must shape the strategy, because only our communities can speak to the realities we face and the solutions that will actually work for us. This consultation is our chance to change that. This is the first time Aotearoa has attempted a national hearing health strategy, and if Pacific voices are not strong in this process, we risk being left out of the design again. So today is really about you, your insights, your hopes, your ideas for what hearing health should look like for our whānau, ainga, and family. We want to hear what works, what doesn't, and what needs to change. Please take the time to complete the survey, share it with your networks, and encourage others to have their say. Your feedback will directly shape the next version of the strategy. Māloa Pito, thank you for being here and thank you for contributing to this important work. I'll now hand over to Natasha and Kera to take us through the strategy and the consultation process. Māloa Pito.
Talai Falaba and warm Pacific greetings. I'm Natasha Gallardo, Chief Executive of the National Foundation for the Deaf and Hard of Hearing. Thank you for joining this Talanoa. We appreciate the opportunity to share our vision for a national hearing health strategy and, most importantly, to hear the perspectives, experiences, and insights of Pasifika communities. I would like to briefly introduce the strategy, share what we are hoping to achieve, and explain why your voice is so important in shaping its future. The first thing to know is that Aotearoa, New Zealand has never had a national hearing health strategy before. Yet hearing health affects nearly 1 in 5 New Zealanders, and for many people it impacts far more than just their ability to hear. Hearing health affects communication, education, employment, well-being, social connection, and participation in family and community life. For Pasifika communities in particular, hearing health can have a profound impact on relationships, culture, language, church life, learning, and the ability to fully participate in community and family activities. The purpose of this strategy is to create Aotearoa's first national co-designed approach to hearing health. Our vision is simple but ambitious, that all people in Aotearoa, New Zealand with hearing loss can achieve their full potential through access to services, rehabilitation, education, and empowerment, delivered in culturally appropriate ways, and that no person experiences hearing loss due to preventable causes. At its heart, the strategy is about system change. We want to improve prevention and early identification of hearing issues. We want better access to hearing technologies and support services. We want stronger rehabilitation services and communication support. We want to raise awareness of hearing health and reduce the stigma that can sometimes prevent people from seeking help. Most importantly, we want to reduce inequities so that everyone can access the support they need regardless of where they live, their culture, income, age, or circumstances. The strategy is built on strong foundations. It recognises te tiriti o Waitangi and supports Māori-led approaches for Māori. It also recognises the importance of Pacific-led approaches for Pasifika communities and community-led solutions more broadly. We know that communities understand their own needs best. Solutions are more effective when they are designed with communities, not simply delivered to them. So what have we done so far? Over the past few years, the National Foundation for Deaf and Hard of Hearing has been working alongside our member organisations, hearing health experts, clinicians, researchers, people with lived experience and community stakeholders to develop this concept document. We have drawn on international evidence, including the World Health Organisation's World Report on Hearing, as well as New Zealand research and the experiences of people working across the hearing health sector. The document outlines a proposed framework for improving hearing health in Aotearoa. It includes actions around prevention, screening, early intervention, access to hearing technology, rehabilitation, communication support, noise reduction, and public awareness. However, it is important to emphasise that this is still a concept document. It is not a finished strategy. We see this as a starting point for discussion, partnership, and co-design. The consultation phase is where communities have the opportunity to genuinely influence the final strategy and how it may be implemented. And that brings me to why hearing from Pasifika communities is so important. We know that Pacific peoples experience inequities in access to hearing healthcare and support. We also know that hearing health cannot be viewed only through an individual lens. For many Pasifika communities, well-being is collective. Decisions are often made within families, churches, and communities. Culture, identity, relationships, and connections all matter. The strategy already acknowledges that Pacific people who are deaf or hard of hearing may experience a unique intersection of culture, disability, and health. It commits to Pacific-led solutions for Pacific people and recognises the importance of culturally appropriate and accessible services. But we do not want to make assumptions about what those solutions look like. We want to hear directly from Pasifika communities. We want to understand what barriers people are experiencing, what is working well, and where change is needed. We want to know what culturally responsive hearing health services look like from your perspective. We want your thoughts on how Pasifika communities should be represented in the future Hearing Health Alliance that will oversee the implementation of this strategy. We want to understand what cultural values, frameworks, and ways of working should help guide this work. And we want to know how we can ensure hearing health services strengthen families and communities, rather than expecting people to fit into systems that may not have been designed with them in mind. This is not a tick box exercise. The feedback we receive will help shape the final strategy, influence future priorities, and guide how programs and services are designed and delivered. Our goal is for this strategy to reflect the aspirations, strengths, cultures, and lived experiences of communities across Aotearoa, including Pasifika communities. So while we are here to share the concept document, we are here even more importantly to listen. We value your experiences, your perspectives, and your ideas, and we thank you for being part of this important conversation. Thank you. I will now pass over to Kera, who will talk you through the consultation process.
Kia ora koutou, he uri tēnei no kaitahu kātima moi me waitaha. O Kera Sherwood-O'Regan aho. I'm Kera and I'm the Māori Policy Lead supporting the Hearing Health Strategy at NFDHH. So today I'll be sharing with you how you can be involved in creating the Hearing Health Strategy that makes a real difference for your community. There are a few options for how you can share your feedback. Firstly, go ahead and check out the consultation document. It's available at the link below. Then let us know what you do like, what you don't, or what ideas you think would work better to achieve our shared goal. You can do this via the survey on our website, or you can email your thoughts to hhs@nfdhh.org.nz. If you have any partai or any questions, or if you need an alternate format of the survey, like say a printable copy or a version for screen readers, please do reach out to us on that email. Again, that's hhs@nfdhh.org.nz. This consultation will be open until 11:59 p.m. on Sunday, the 19th of July, via the online survey and via email. So please, help us shape a hearing health strategy that will deliver for Pasifika communities across Aotearoa. Take the survey, send us an email, and share this video. Kia ora.